Following a routine visit to my optician, I was referred to George and his team in order to have lens replacement. Once I'd got to the initial consultation, it became clear that my case was a little bit more difficult than standard. I had some unstable ligaments in the back of my eye, which they were concerned because if I'd had the lens replacement and it had not gone entirely well, then the lens could well have fallen back into the eye, I guess leading finally to blindness. I felt very comfortable having George do my surgery. He clearly was an experienced consultant, and as he took me through all the various risks and issues that may develop, it was very clear that it was not going to be standard surgery. It was during the discussion with my optician about my short-sightedness and the fact that it had been getting worse and worse since I was very young, that I needed a more permanent solution. At the end of the day, the short-sightedness was affecting me in so many ways, whether it was through my hobbies, my sports, but at the end of the day I needed a solution, and we both felt that lens replacement was the answer. It was clear during the consultation process, and I must have had perhaps 2 different consultations with the experts down at the team, that my eyes were not ideal. The ligaments were creating a very unstable, almost a wobbly lens. And one of the risks in having the surgery is that the ligaments would not have secured the new lens in place in a very effective way. And should this happen whilst I'm on the table, that he would need specialised equipment in order to correct the problem. Therefore, both with George and having the operation done at a different location, we were able to mitigate the risk that I was going to undertake. On the day of the surgery, the team were great. They made sure that I was rested, I felt assured, and when I did go in, everything was being done to help me. The surgery itself takes no time at all. It was really quick and easy, and I was back out into the recovery room, having a cup of coffee, and soon back on my feet. Once I left the hospital, it was a matter of hours before it became clear the advantages of having this operation done. And within a day or so, it felt as if everything was back to normal. My vision was perfect and I was feeling great. Having had one eye done and the procedure gone so well, I'd signed up immediately to have the second eye done a couple of weeks later. The same difficulties were there with the ligaments, but I felt really confident that it was all going to turn out well. George had been in contact with me a few days later to make sure all was well, and after a few weeks I went back in to see him for a further consultation. He thoroughly checked the eye through, made sure that the procedure had gone well, that the replacement lens was there and it was stable, and that made me feel very confident. And now my vision is perfect. Everything's well, I have no problems with my sight. It's basically gone back to how I was when I was a child, before short-sightedness became a problem for me. And for that, I'm very thankful to George and his team. So having been through this procedure with George, I'm obviously more than happy to recommend him and his team for any form of eye surgery.